July is Minority Mental Health Awareness Month. It's observed to destigmatize mental health struggles within racial and ethnic communities. I'm joined by Dr. Callie D. Cyrus, licensed psychiatrist, to talk about the goals of this month. First of all, it's really wonderful to meet you. Thanks for coming in.
Thanks for having me.
So why is having a month designated to this important in your opinion?
I think of it just like Black History Month, to make sure that we're actually drawing attention to the fact that this is an issue within this community. We know that racial minorities and also LGBTQI folks, so other identity minorities, have a hard time finding access, and then also qualified professionals to treat them. And so this is a month to say, let's start talking about these issues, just to make sure we actually get to it.
Right. You know, during the pandemic, it seemed like a lot of different apps popped up and different, access to mental health if you needed help somewhere to go. How did it change during the pandemic, in your opinion?
Yeah, so for me, it's actually a positive change, because for the first time, I felt like everyone was talking about mental health, and it felt way less destigmatized, in my own words. So I think people had a lot more avenues to be able to talk about mental health with someone, which definitely increased during the pandemic, but I think we also saw a shortage. And so right now, at least so many of the therapists and psychiatrists I know are packed in their schedules. So demand is even higher than usual.
This, a little off script, but did the pandemic sort of expose different vulnerabilities, do you think, that we all have?
Yes.
Okay.
Yes. Again, think about, when was the last time in history where everyone was going through the same stressful experience? And so I think we saw folks who are already interested in therapy seek those services, and then we saw new folks for the first time looking into getting therapy. So many of patients that I have who for the first time never saw a psychiatrist, never saw a therapist. And that's really wonderful.
Absolutely.
Yeah.
Okay, so let's get into the racial and ethnic minorities here affected. How are we affected when it comes to mental health and also getting the help we need?
Yes, so first of all, there is a shortage of mental health professionals who are at least from racial minority backgrounds. That's one thing. And two, the cost. Because it's not covered by insurance generally, maybe that's changing some, but there's this concept called parity. Do you pay for mental health care as much as you pay for physical health care? And because we don't have that equality, then it's really hard to get mental health care. You have to pay out of pocket if your insurance doesn't cover it. And that's one of the reasons why it's hard to find professionals who you can afford or that your insurance doesn't cover. And there's also just not as many Black or Latinx psychiatrists or mental health professionals in general, because of extensive training and what it costs, and in general, educational issues.
I would think that that would be important to see representation for a lot of people. So how do we make that work then?
So it's really tough. Even me myself, I see someone who's not Black because that's what's available in the area where I was looking initially. But I think that that's changing some. And so while you might not be able to find a Black psychiatrist or a Black psychologist, you might be able to find a Black social worker or someone else. So there are a lot of other fields that of individuals who provide therapy, and sometimes that's a great option if that's also what you can afford and who's around. But we need to increase the amount of opportunities to be able to get in this field, which I hope the pandemic has done, is really motivated folks.
Okay, is there any way to get any free help out there?
So there is the Access Helpline that we have here in DC that you can call if you immediately need help. And there's also a crisis line with that as well. You can dial 311 and they can connect you. You can also, that might be it.
Yeah, right. Which is interesting, because you spoke about parity with physical and mental when you seek help. We talk about stigma within the communities, but it seems like there's also a stigma within the medical community, if that's still true.
It is true. It is true. I mean, even just being a psychiatrist who went to medical school, a lot of folks don't even understand that I went to school with surgeons and the pediatricians. There's just a lot of unknowns, and maybe we don't talk about this field so much. So I think people have a big question mark. So how do we destigmatize? And I think that is talking about what's out there and what's available, so that you don't feel as like you have to look this up in some secret place to be able to gain access, that it's more accessible to you, that it's easily, it's something that we talk about across the dinner table of, did you see your therapist? Just like you go talk about your primary care doctor.
Right. We've been talking about, racial and ethnic minorities. Let me get into some family business here. we as Black people, we need to work on how we talk about mental health, how we look at people who are say, I need help. Do you see that ever going away? How can we get there?
I will say it is getting better. We have Michelle Obama talking about her mental health. We have Taraji Henson, who has her foundation where she addresses mental health. So I see a lot more celebrities are coming out. And I think, again, with the pandemic, my practice is exclusively Black and brown and LGBTQI individuals. And I've seen, again, so many Black older women who for the first time are coming to therapy. So I think something is happening where we either can't take it anymore and we need to start talking about it, but it doesn't mean something's wrong with you. Just like, again, you might have diabetes or high blood pressure. What if your brain and all the social stressors that are going on have triggered some kind of depression that really does create like a gray lens where you are seeing the world through a extreme negativity bias.
Right.
And why not just talk about it? It's not your fault necessarily. And talking about it actually does help.
Right. And before we let you go, if left untreated, I know it depends on exactly what the struggle is that you need help with, but if left untreated, it doesn't get better.
No.
Right,
No,
right.
It might ebb and flow. It might get better
Right.
for a little while, but it's going to come back again, which is why it's important to connect with someone who can help you understand what's happening and create some coping mechanisms or strategies for when you notice this starts to happen, which may be connecting with your family members. It might be working out or going to yoga. It might be going to church. It might be just getting out of the house and exposing yourself to sunshine. But if you hold it yourself, it's going to weigh you down.
Right. So, Dr. Cyrus, we do a Get Uplifted story every day. We try to balance all this heavy news that we do. We also have a Get Uplifted hotline, just a little pep talk, messages of encouragement. How important is that?
Oh, wow, that's super cool, first of all. So one, our brains, we tend to notice the negative more than the positive. So for every one negative thing you might think or hear, you need 5 positive things to actually, counteract that.
Okay.
So when you think about leaving messages or being able to call into a message like this, that's so powerful to have access. One, just hearing someone's voice, you process physically and mentally, and you can hold on to that. You can replay it. I'm not sure if that's possible, but again, think about how many letters you've saved or other voicemails that might have some special meaning to you and what that can give to someone who may not have anything else or any other positivity coming their way.
Okay, well, we're going to keep it going. And meantime, it's been a pleasure to speak with you. How can other people get in touch with you? I know you said you're busy, but if somebody's trying to reach out to sit with you.
Yeah, so you can find me on most social media handles. I'm on Facebook, I'm on Twitter, I'm on Instagram at Dr. Callie Cyrus.
Okay,
Yep.
all right, awesome.